Hello and welcome to the low limb osteoarthritis program, session 3, delivered to you from the Joint Health Department at Southport and Ormskirk NHS Trust. This session really we're looking to review what's next, and hopefully by this point you've gone through at least 4 weeks of exercise program, completing the whole program 2 to 3 times a week and maintaining some form of activity on a daily basis, as long as we've not had any major flare-ups, but we know how to cope with those. And if you can't remember, skip back to session 2. So what we're going to cover today, we're going to have a look at other treatment options. So essentially failing conservative management, what other treatment options are available, when and why do we use them, and try and give our patients some context around those decisions and how we make those decision makings. Questions, of course, are difficult via video, but you know how to direct those questions should you need them. And we'll touch on where you can go for some medication advice in a moment. And then also looking to plan for the future and looking down the line with your osteoarthritic advancement. Okay, treatment options. Now it's difficult to be overly specific when we're trying to generalise this education and advice to our general population. So some of it may not feel quite as relevant to you, and sometimes you may feel like your current pain or your current condition is worse than what we've alluded to previously, and that's okay. This is why we have these secondary treatment options, but bearing in mind that before moving forwards with any of these options, we need to make sure that we've properly invested time and effort into conservative management. So walking aids is a nice way sometimes just to give our patients some confidence after a period of inactivity, and sometimes it's part of their reliance. And I see and hear a lot of patients don't like to use walking aids, walking stick, frame, four-wheel walker, etc., because it makes them feel old, or it makes them look old, or it makes them look not as capable as they once were. We can sympathise and empathise with that, but what we're trying to do is keep you safe and also maintain those levels of activity that you were previously able to complete. So it's very important that you don't look at the walking aid from an aesthetic point of view. You look at it from a function point of view. If a walking stick can help you walk to the shops that you were previously struggling with, then it's a good adjunct to use. If you need any advice around your walking aids and walking sticks, then you can talk directly to our sales and department, or you can go down to your local mobility shop and ask for their advice as well. Another thing that we can use is medication, and now what medication we use in osteoarthritis is quite specific. So the optimal management for osteoarthritic change, which is kind of the European standard, and this information's from the European Congress of Rheumatology and their recommendations, it requires a combination of non-pharmacological and pharmacological treatment modalities. So we're looking at that conservative exercise technique, and then also looking at medication to complement that. But in terms of the pharmacological treatments for it, we're looking to take paracetamol or analgesias like paracetamol nice and regularly, not taking anti-inflammatories, oral anti-inflammatories like your ibuprofen, etc. We're looking to stay more down the paracetamol route, and of course you can get more stronger versions of paracetamol, and if you do require any advice around that, then my advice is to go to your local pharmacist, explain the situation, and move forwards with those guys. They're very good at what they do. In terms of topical applications, you're trying to apply non-steroidal anti-inflammatory drugs like your ibuprofen gel alongside your paracetamol, and taking these both nice and regularly and applying them in conjunction with one another. Now, medications need to be taken consistently for them to have their desired effect. So pick 2-3 times in the day when you know you can consistently take it, and then see if it's helping your pain or relieving your symptoms in any way, shape or form. If after a continued use of medications, and sometimes even using stronger medications alongside your conservative management, using walking aids if you need to, if at this point our pain levels are still high, we're not getting control of it, it's been over 6 to 8 weeks and we're still really struggling, then we might consider you for either injection or for orthopedic opinion. But those two options come at a cost. You know, they're higher risk. Both of those involve invasive treatment of the limb, so your risk of infection is higher. And of course, anything where treatment goes beyond conservative management is by nature slightly more risky, and that's not a reason to put you off. You just need to be aware of what the possibilities are. So for injection or surgery, we'd have to send you for an x-ray. We most commonly inject the knee in department here, but at first we need to make sure that the knee can accept the injection and make sure that we have enough room. So an x-ray is a really pivotal part of that. We'd refer you on to one of our specialists at this point, one of our advanced practitioners who has been injecting for a long period of time and is a very experienced therapist, and they will clinically reason the need for an injection should you require one. But injection or surgery is further down the line. It's definitely not something that we jump straight into as we may have done in the past, so it's important that we take these decisions seriously and make sure that we know all of our risks about them moving forwards. Should you need any more information around your injection or your surgical intervention for osteoarthritis, there's some really great resources online. So if you head over to Ortho Bullets and around HCI injection, it's a really good resource for those looking. And then any further information around OA itself, you can head towards the National Institute for Health and Care Excellence, or NICE, and they're the guidelines that we follow in department here. You can then also go to arthritiscare.org UK, Arthritis Research UK, NHS Choices, and these websites all have really valuable information for our patients in varying degrees of depth. And there's a few other resources that we can use in terms of looking for activity in the locality. Using Active West Lancs is a really good way to do it. So the gyms that are based around West Lancashire and Sefton have a similar service. And then also if you head over to the versusarthritis.org website and just type in exercise at the top, they've got some top tips and some specific exercises for you to try if what we've sent you from department here hasn't sufficed or you're looking to mix things up a little bit. And failing all that, you can always get back in touch with us here at Ormskirk and Southport, and we can alter those exercise programs for you depending on how we've delivered to them in the first place.